Okay, Nee, welcome to the show. Thank you so much for taking the time to be with us today here at True Hope Podcast. How are you? What is going well for you?
I am great. Thanks for having me. I am in Southern California. It's nice and sunny outside. Uh, Today was a good day.
Excellent. I'm glad to hear that. Well, why don't you just, as an introduction, tell us who you are and what it is that you do.
No problem. My name is Dr. Ni Deng. I am a family physician. I've been practicing for over 10 years. I'm a lot older than I look. I am married, have two sweet little girls. They're actually the reason why I wrote these book series for their generation.
Amazing. Yeah, we're certainly going to get into the book series. It looks very interesting. The adventures of Max and friends. We'll
Mhm.
certainly get into that. And yeah, it's wonderful kids what kids can give you as gifts, creativity, and
Yeah.
all of that. Quite remarkable. So why don't you tell us a little bit about your personal journey, your experience with mental health as a physician?
No problem. Yeah. As you know, all of us go through medical school to become a doctor. So during medical school, you have um, criterias that we memorize, definitions that we memorize, to meet certain criteria for certain diagnoses. Even in mental health, we have certain criterias called the DMS-4 that we follow. Um, but it's not until we finish medical school where we go to residency, and that's when we actually get like more personal firsthand experience with patients and kind of see the true colors of mental health. And you realize that it's not just those definitions and those criterias. It's much more deeper than that. That's when I think being in practice for a while is when the more you practice, the more you realize, that understand the conditions more and kind of relate more to the patients. And you pick up all the nuances that you didn't pick up, when you're just in med school and just trying to memorize certain definitions and criteria for for any of the medical conditions overall, but especially in mental health where it's uh it's kind of a tricky topic that you kind of have to experience to really pick it apart.
Yeah, well, mental health is quite specialized, right? So I wonder, like, during your, general education, during medical school, which is obviously very vast, very extensive, but it's also very broad in regards to different topics, right? So,
Yes.
what within your what was the mental health training like? What was the mental health like? Pathophysiology like? What did they really discuss in regards to the actual, like, fundamental training, I suppose?
So let me see. Go try to remember what the what we learned. So we did have like a block where it was kind of concentrated on mental health, but since it's kind of a catch-all, like know all these conditions and all these things you might run into. It wasn't a very like in depth um, into each. You can't really jump super in depth into each condition. It's more just a general overview. These are the criterias. These are things to look out for. Um, so then, take that times 100,
Yeah.
and then that was our education. So, like I said, it's not until you really practice when you see the patients when you have a better understanding of the pathophys behind the conditions and things to look out for.
Can you give us an example in regards to, so yeah, as you say, when you're studying medical school and you are going over, let's just say, 100 different psychological disorders. Obviously, some are more common than not. So you learn that stuff from a lecturer, from a professor, and you obviously have to, learn that information. And it's, very much student, lecturer, book. It's all very much like you learning it through books and through the experience and the
Mhm.
um, written definitions, I suppose, and written
Yes. Yeah.
criteria and kind of the pathways that you would go during the process of diagnosing. Compare that to actually, being a doctor, being qualified, and then you're practicing, you're taking patients in and you're seeing them day to day. How wildly different was, experiencing someone with depression opposed to just like learning about it in a textbook?
Yeah, so that's why that takes a lot of learning. Sometimes, so in textbook, or even on tests, they give you all these whole scenario, they give you all these diagnoses, and then based on your what you can recall from what you can recall and memorize, you're like, okay, that probably qualify for this certain criteria would be okay. Let's say depression, like okay, that guy has pretty much all the criteria. What does he have? He has depression, right? But in normal practice, no one goes in and gives you all those symptoms, right? For most people, let's say depression, for example. I realize that most people they don't come in telling you that they're depressed, that they haven't had the pleasure of doing things. They don't give you all those criterias. So they most likely they'll come in, from my experience, saying they've just been feeling tired lately, no energy, um, just don't feel like they want to do very much lately. So it's very very vague symptoms, correct? That can mean like a whole slew of things. So then so that's what takes practice when you kind of dive in and ask them further questions and keep trying to tweeze it apart, trying to realize like, okay, I think I know what's going on here now. So that's what the difficulty with mental health is, that if you don't have it on your radar, you won't catch it.
Certainly. And have you seen in the last couple of years, especially with, with COVID, have you experienced a rise in certain conditions or a rise in psychological conditions coming in to see you over the last kind of couple of years? What have you seen as a um, unwanted response to, the last couple of years?
Like obviously with the pandemic, we have more people who are laid off. They're more anxious about the pandemic. They're more depressed. With certain situations, they can't see their family members. So there definitely have been a high rise in depression, anxiety overall, not just in my practice, but any other doctor's practice. Um, but I also realize there's also a rise in these symptoms in kids as well, because they're not going to school, they're doing homeschooling. One, one case that struck out to me that I can remember was, I think it was a 11-year-old girl. She came in with her dad. Um, her dad's saying that she's really having struggling with the homeschooling. She used to do really well in school, and now she's just kind of falling behind and having trouble concentrating. And getting deeper into it, she finally, opened up and said, I'm really struggling. I miss my friends. I don't want to keep going like this. And she was admitted to having thoughts of hurting herself as well. So that really stuck with me, and that's one of the reasons why I kind of pushed me forward to write the series to kind of help educate children, because I'm glad it brought me in, brought her in to see me, but I was seeing that case really stuck with me, and that made me really realize, how much like lack of understanding the general public has for mental health and the importance of mental health.
I've just got a question for you in regards to, you have someone who comes in, you diagnose them, and then, there's like a criteria or a model of care that you would go by.
Yeah.
How far off that are you allowed to go? Like, we know how important exercise is for mental health. We know how important vitamin D is. We know how important other supplements and eating right and, hydrating and like all these kind of other aspects. Are these things you can, obviously you're quite also limited on time in regards to seeing somebody one-on-one. You've got loads of patients waiting to come in, so you're kind of limited with what you can discuss.
Mhm.
So how far off, and do you even get the option or the time to be able to discuss how, like what someone's like stress levels are at home or at work, or like do they have the ability to be outside for periods of the day, or to move their bodies, or to eat right? Do you even get time to have those conversations?
So yes and no. When initially they come in, we kind of sit down and I get more information for them, trying to figure out what is going on to begin with, right? So, once we get that down, I kind of explain to them, this is, I think, what's going on. This is the general treatment that we generally provide. So generally what most of us do is we say, okay, I'm going to put you on this medication or have you go see a therapist or, whichever combination of such. But we would like to see you back in a month so we can follow up on this and then we can discuss in more detail what other alternative things you can try, what's working, what's not working. So, like I said, being that busy, the first initial visit's very hard to kind of like lay everything, all the cards out, right?
Of
We're
course.
just trying to just figure out what the heck is going on first. And once we get that nailed down, then the following visit we have a little more time to go over different alternatives and things that we can implement or try. The hardest part is the buy-in, right? If they're like, what are you talking about? I don't have depression. That's the hardest part is the buy-in. And
The
once you have,
acceptance. Yeah.
yeah, once you have the buy-in, they're like, okay, I think I agree. I think I'm willing to go along with this treatment plan. Then it's much smoother the following visits. But if you can't get them to understand or believe you or buy in, then it it's like talking to the wall.
Yeah. Understood. Yeah, that's super tricky. What have you seen in regards to when you're giving advice to people, and you're giving recommendations, and you're even prescribing pharmaceuticals? What do you see that like works well for people when they come back and see you, or what do you find that really like works and supports for people?
In general, I think what really um, gets people to buy in or go along with it would be to reassure them that actually the treatment isn't permanent. So a lot of people coming in, they're like, "Oh my God, I'm going to be on antidepressants or anti-anxiety medication the rest of my life. I don't want to do that." So I think, you know, like I said, when I first started, I didn't realize that was their biggest concern, right? But as you get more experience, you realize that's a big concern for like 90% of people. So you kind of have to throw it out there, explain to them like, look, this is not permanent. This is to help re kind of retrain your brain synapses, as you get all their receptors in line, kind of resetting your brain almost. And then once that happens, we can taper you off and get you off, and hopefully you'll be back to normal. So so yeah, so
Interesting.
so I think that
Interesting. Yeah.
that's the biggest pushback that I didn't realize that was inherent in these things until I practiced more and realized that was their biggest concern. But a lot of people they don't bring up, and but some do. But a lot of people, if they're resistant, they don't bring up why.
Yeah. Specifically with mental health, do you experience patients come in and they are looking for a quick fix, like they want that pill or that drug or that pharmaceutical that's going to, fix them? Do you experience that type of attitude, or do you experience people who come in and, as you say, they don't want to take this drug for the rest of their life, so that might help them like revalue and rethink about the other things that they can do to support themselves?
Mhm.
Yeah, do you see that particular type of attitude? Like, I know in my experience with a lot of people who, we kind of like want to fix our issues like really quickly. Like I'm a nutritionist, and some of my clients, they're expecting this like one diet plan that I give them
Yeah,
to like fix everything in
yeah,
2 weeks, and they're going against 20 years of psychologically
yeah,
wired and fired patterns, and it's just not going to work like that.
yeah.
Is that what do you experience that?
So I think it's like a mixed bag for me. Like some people, yes, they definitely go in and like, okay, whatever I have, I just give me something, fix it. I want to move on. Other people are like, let's maybe try something else, try to kind of correct this in some other natural way. So it's kind of a half and half for me.
And what type of advice do you have for people who are struggling with their mental health? I'd say most people are, are becoming a lot more aware the mental health is a thing. It's actually there. Everyone's kind of like everyone has it. Everyone's dealing with it in their own different ways, and the degree in which people suffer obviously is very
Different.
very
Yeah.
vast and different. So do you have any like advice like to me, to the audience, like right now, like a few things that I can do, that I can implement into my day that's going to, support me, support my psychological health?
Yeah. So the biggest thing about mental health is that there's a new trend that actually I find very effective called mindfulness meditation. I'm not sure if you heard of it, but it originates from the Buddhist religion, where mindfulness meditation basically is not a meditation where you zone out, you go into this like trance type state. It's basically mindfulness is where you're just concentrating on the moment, and you kind of so most of the mindfulness meditation I do is the breathing techniques, and you kind of um, visualize what's going on in your body, feel your own body, just be in that moment instead of worrying about the future causes anxiety, worrying about the past causes depression. You're just in that moment. So the mindfulness meditation actually helps you stay focused by being in the moment. So I think that's the biggest thing you can start doing for just your own mental being. If you're just doing 10 minutes of a mindfulness meditation in the morning before you start your day, or if at night you suffer from insomnia, do some mindfulness meditation before bedtime. For me, I get through like half of it and I'm knocked out at night. So that's my sleeping pill.
How and why does that work? I mean, I'm very familiar with that type of meditative technique, and I believe that you want to, if you're doing it for the first time, or you're bringing that into your lifestyle, you're using it as a way to become more conscious in your kind of everyday
Mhm.
experience. So a lot of people who have severe anxiety or severe depression are constantly in a state of not being in the moment.
Yeah.
But the more we can bring ourselves to be present and be in the day, then but how and why does that work so well?
I feel like for people that are suffering from anxiety, their brain can't shut down. Like they're constantly like even people that tell me they suffer from insomnia, a lot of times it's from because they have a lot of anxiety. They're thinking about what's going to happen tomorrow, what's going to happen the next day, what I have to do at work. So their brain is constantly on the go, go, go. So it's more like their brain is in the the fight mode. So they're not, able to shut their brain down. So the mindfulness meditation, what it does is kind of just those like thoughts. Once you get good at mindfulness meditation, anyways, then you will concentrate on the moment, and you kind of those worries and the concerns in the next day you kind of push out. So you're able to just concentrate on the moment and let your body actually relax. And that's how you kind of rewire your brain to just be in the moment and not worry so much about the future that you're not even enjoying the moment. Let's say like you're with your kids, you're not even enjoying your time with your kids because you're worrying about what's my boss going to do to me tomorrow, what I do at work. You're not able to just enjoy that moment that you're spending with your family.
Are you able to explain a little bit around like the biochemistry of what happens when, as you say, somebody who might be constantly having anxious thoughts, somebody who might be having constant depressive thoughts, how, because you just touched on that, on like the fight or flight nervous system, and how that engages a very, very different set of hormones and neurotransmitters, rather than, if you were in a conscious meditative state, for example, or like let's just say calm or relaxed, or like a homeostatic state, your body, your nervous system is engaging in a completely different pathway of hormones and neurotransmitters. Are you able to maybe touch on that a little bit in regards to how that helps somebody shift from an anxious state to a not anxious state?
Yeah, so in general, for anxiety, what it does is it raises your cortisol level, which is your stress hormone level, and that will activate your sympathetic system, will make you in hyperdrive. But as you calm down, you can reduce your cortisol level, and then your body will are able to shut down more and go into a more parasympathetic system, which is the relaxed mode.
Perfect. Yeah, that was great. That was awesome. I just find it so fascinating that um, anxious thoughts or depressive thoughts that we have that we don't really consider to be like matter or something that we can, physically see if we opened up our brain, but they can very much cause, physical problems and disease and pathology, right?
Yes.
Are there some more common ones? Let's take anxiety for example. If you are anxious and you are in this stressed out nervous system for so long, and you're pumping all this cortisol and all these other hormones and neurotransmitters in your body, how does that lead to a physical problem that we would then go from diagnosing anxiety to something like more significant that's actually affecting like an organ or has created something else?
Yeah, that's actually a good question. So I think I read one study where a prolonged cortisol level in your body can actually start causing stress on your heart, leading to a higher risk of you know, cardiac disease and MIs, or which is heart attacks. So it's not something just isolated to your brain. It can transfer down to the rest of your body as well.
Yeah, that's remarkable that how that happens. And I think for a lot of people, they might not correlate a physical disease with like maybe the anxiety or depression or stress that they've experienced for like 10 years, because obviously some people go through their whole life feeling some sort of level of anxiety and not necessarily understanding that that down the line for a long period of time the body can't sustain it, and there will be problems and errors along the way, that the body needs to be in a balance between being in a sympathetic pathway to a parasympathetic pathway where we're healing, and we've got this rest and digest, and our digestive system's working properly, and we're able to heal effectively and sleep well over a long period of time. That will eventually lead to problems down the road. And I don't know if
Exactly.
many people are able to correlate those things, because usually the timeline between those things is quite different, and we
Yeah.
get super comfortable with being an anxious person or a stressed person or a depressed person. It ends up being just part of our day-to-day, part of our personality, and it's quite remarkable what we end up actually living with, whether that's anxious thoughts or actual physical pain. It's quite remarkable how we deal with so much of these things.
Yeah. No, definitely. That's on point. Like, I think the biggest uh, message I can relay is that I wish that we wouldn't think of mental health as being separate from your physical health. Like, people think like, oh, depression and anxiety just are mental conditions, and they think like, let's say like diabetes and hypertension. That's a two. Those are different things. I wish that they can just start kind of combining those conditions and say, they're all a medical condition, whether it's mental or physical. It's all one unit. I wish they can just be like, yeah, I have depression just like I have diabetes or I have hypertension. I wish they can all just think of all of those conditions as just medical conditions, not just separate them into physical medical conditions or mental physical conditions. I wish they would just kind of be like, you know what, these are all medical conditions and they all need treatment. And there's nothing like to be ashamed about having any of these conditions, because they are all medical conditions. Like just like having cancer, it's it's all conditions. Nothing nothing to be like ashamed about or to not bring up or not discuss.
No, I find so much motivation and power comes from a lot of people who take, let's just say, cancer diagnosis for example, and then they use that as their big moment in their life, their big awakening. It can take something like that, a tragedy, a trauma, or a death in the family, for people to really reflect on what's going on for themselves. And it can be a really remarkable motivator
Mhm.
to make really significant change that people have probably been putting off for a long period of
Yeah.
time. So, but I can obviously understand the people who do get that type of diagnosis or something else, and it can slip them down like a terrible path of further stress, further depression. And we know that that's only going to fuel the degeneration of the body, I suppose, if you were continue to flood the body with that type of inflammatory state. It's very, very interesting. I have a question in regards to what's the conventional medical thought at the moment on like the idea of like chemical imbalance with like depression?
So the general thought is that that's what when we go to the medications. So the medications, we have SSRIs and SNRIs. So basically, all these medications are trying to raise their serotonin level in the synapses in your brain. So what it does, one prevents from the serotonin level from being uptake and destroyed. Other ones trying to just stimulate more receptors to take in the serotonin receptors. So we think that there's some imbalance, or deficiency, should I say, in the serotonin level in the synapses. So most of the medications are aimed at increasing those serotonin levels.
And
So
yeah,
the serotonin levels actually are receptors are not just in your brain. You have a lot of serotonin receptors in your digestive system, your gut. So that's why a lot of people, when they do take medication, I explain to them that you do have a lot of receptors in your digestive tract too. So when you're increasing the serotonin level in your body, it's not just localized to your brain; it's your whole body. So that's why when you first start these medications, a lot of people will have like gas, bloating, some abdominal discomfort, loose stools. So those are just your GI system responding to the increased serotonin level. So I always explain that to people when all my patients when they first take the medication because that's what uh, it's supposed to do.
great. That's a good explanation. Thank you very much. And I had a chap on the show. I recorded an episode yesterday in regards to so this guy he supports and he's attempting to assist the mental health care in developing countries. He's trying to do that from North America, which is just amazing. But I wondered what type of like continuing support and education do you receive as a physician in California from like your governing bodies around mental health and the development of the understanding of what actually is going to end up supporting our mental health, whether that is supplementation, being outside community, different types of therapy, mindfulness meditation that you're talking about. Is this something that you have to research and try out yourself, or do you get continued support from your governing body, to further assist you?
Yeah, so to renew our license, we do have to have something called CME, which is a continuum medical education, so certain hours. But you can spend those hours as such. You don't have to be on mental health, or it can be on any topic. So they don't directly hold our hand in terms of leading us, in any type of direction. So I think that's kind of entirely up to you and your practice. So if you in your practice, let's just say you have a lot of mental health, then you're obviously going to spend more time doing those medical education on those topics. Whereas if you're in a population where you're caring for certain conditions like diabetics or such, then obviously you would spend most of your time kind of increasing your knowledge on those topics. So it just depends on what kind of demographics you see.
Yeah, it depends on the patients you come in, and obviously you would have a personal investment in that as
Yeah,
well in regards to like
exactly.
where you want to go, because obviously that interest
Yeah,
would be very very valuable for that learning experience as well. That's really cool. Let's talk about your book series. It's like introduce the books, introduce the idea. Why did you write it, and who's it for? Because I think it's very interesting. So please.
thank you. So my book is it's a book series. The title is called The Adventures of Max and Friends, and it's a series of 8 books where you follow the main character. His name is Max, as he starts the first day of 6th grade through the summer. So as he goes through the year, him as well as his friends that he makes along the way are going all experiencing different struggles of their own, different mental health struggles. For book one, for example, he's been dealing with a bully for several years, and then he ends up standing up to his bully. And I want to give away the book, but basically, it doesn't end well for him. Um, So usually for the books, at the end of the book, I have a notes from the author, kind of explaining each condition and more deep, like medical condition, medical terms, and kind of explain what's going on. For example, the first one is about bullying. I already give it away. A lot of times bullying, people don't really make much of it. But there's a lot of, when I was doing research for that section, you know, students that are chronically bullied, they have more chance. They're more likely to develop depression, have like poor social skills, and then and they're more prone to um, illicit drug use. So just basically um, those misconceptions that bullying, yeah, it's not a big deal. He'll grow out of it, make him tough. It actually, it can cause really serious damage mentally in the long run, and that little kid will grow up to be, an adult that will have these conditions with him or her.
Yes, I mean it's a very hot topic in regards to youth and mental health. I mean, it's developing all the time. I couldn't imagine being a 10-year-old in
Yeah.
2022. It's a serious business, and yeah, it's like incredibly overwhelming, very very stimulating environment to be in. I would expect it to be. What do you find powerful about storytelling and and explaining? I mean, is this book for parents or is it for the actual kids?
So, when I first wrote this book, I was originally, my thought was to have the parents read it to their kids, but it turned out longer than that. So I think my new target audience would probably be like fifth graders to eighth graders, where they're pretty proficient in reading, and they're emotionally like mature enough to understand these more serious topics, and kind of take it in. I find that storytelling, it's just like much more powerful than like anyone giving a lecture. Just like going back to the whole medical school issue, where we're just learning, memorizing, these sort of definitions, criteria, just there, memorize it, done, right? And then after the test, most of us probably forget about it a couple months later. So, but where storytelling, it goes back to ancient days, right? Where your ancestors tell a story. That's how they keep their culture. They teach lessons through storytelling. So storytelling is much more powerful than like anybody can give any lecture. Where because the storytelling, you can relate to the character. Where I think if you have like an emotional relation, then that's much more likely to be impactful and for you to actually remember, as opposed to someone just like, okay, memorize these things. I'm gonna give you a test a couple weeks later.
Yeah.
Yeah.
Yeah, it's interesting. Yeah, I mean, storytelling, as you say, it's ancient, it's wonderful, and it's getting around the campfire and sharing stories that are especially filled with emotion because regardless of the story, regardless of the storyteller, I think most emotional states most people can relate to, and we can get into that story based on that energy, based on those emotions, which is fascinating in of itself. Is the book Are the books designed to motivate, to educate, to open the eyes to all kind of individuals involved when it comes to that type of a thing, when it comes to kids and school and mental health and bullying, etc.?
Yeah. So the story, actually, each story is in a different character's perspective. So you get to kind of jump into their brain and see what they're thinking, what they're feeling, going through certain tough times. Each of the characters has their own struggles. So the purpose of me writing that is I just want to clear up any ideas like his things, like with the social media, like, oh, their life is perfect, my life sucks, my life is terrible, how come I can't have life like that? I just want to clear that that's not true. Everyone, no matter how perfect their life may seem, has their own struggles. Obviously some people's struggles are tougher than others. I'm not saying everyone's struggle is the same, but just know that everyone has their own struggles, has their own demons to fight. So that's why I wrote it in each character's perspective as they're going through their own challenges. So, I mean, I took some creative liberties in writing the stories, but the emotions they're feeling, the thoughts they're thinking, they're all 100% real. These are like the emotions, the feelings, and the thoughts that my patients and as well as I myself have experienced. I'm just putting that on paper. So then it's more so when I want kids to read it, and if they're going through a certain thing, and see like, hey, that character is actually, I'm feeling the way that character is feeling. Um, I'm thinking that what that character is thinking. So okay, that's maybe it's not just me. I'm not by myself. I'm not like the weird kid. A lot of times when you're having these struggles in your mind, you think it's just you, and you're embarrassed to tell your friends, and you want your friends to think like, "Oh, you're a weirdo." But in reality, that's actually very common. I mean, that's so the purpose of the book is to kind of show them, you know, different emotions that they can exhibit in certain situations, and that's okay. That's normal. That's completely in the realm of normal. So they don't feel like they're by themselves. They don't feel they're weird. They're too scared to get help because they don't realize that that's you're having a medical condition. You're having something. It's okay to tell your parents to get help, and kind of go from there as opposed to just like trying to suppress all those feelings and trying to like just like, okay, I'm not going to talk about it. But I feel like a lot of kids are like, okay, I'm not going to tell anybody about this. Just like bury it down and hopefully it goes away, right?
Yeah. Yeah, it's great that, I mean, I think books are so unbelievably powerful, and the more we have phones and social media and screens and technology, the more I think a lot of parents and kids kind of stay away from books. But I think we always creep back to them. We always creep back to the storytelling. We always creep back to the adventure and the creativity and the mysticism that comes with, like, reading a tale, reading a story. And I think the way back to supporting a lot of kids who are kind of drowned in
Yeah,
this, a lot of it just, fake nonsense online,
exactly.
will help individuals kind of like heal and bring themselves back to themselves and learn how they can, or why they're feeling certain ways and how they can get back. And I love the fact that you're taking the books and writing it in the perspectives of different people rather than just like one individual in like a singular in a
Yeah,
singular way. I think it's very important that children and adults empathize with other people in different situations and recognize that they're going through stuff just like me. They're going to have different perspective, different thoughts, feelings, and behaviors, and being able to really be empathetic to those individuals and other people is only going to assist you in healing yourself, rather than thinking, I'm not good enough, I can't be friends with that person, I. Once you start
mhm,
recognizing that other people have got issues as well, it starts to build understanding around the fact that everyone has their own certain struggles, and that kind of makes it a little bit more okay to deal with yours, rather than thinking you're this wild, isolated outsider.
yeah.
um what advice do you have for parents when actually talking to their kids about mental health? Do you have any advice in regards to how they would do that, or what type of materials would they use? Like, or do you have any resources to be able to recommend to us?
Yeah, so I mean that's kind of one of the reasons why I wrote this book. So it's easier or more organic for parents to talk to their kids about mental health as a because they're talking about the book, so the characters they're like not personal person instead of like asking your kid, hey, are you having these certain symptoms, you can just talk about the characters instead. So it's a little more organic for them to bring up certain topics, um, and for the kids to kind of respond to, so they don't feel like they're being attacked by their parents or like, well, why are you asking me all these questions, like what's the deal? But if you're just talking about the character, they're more likely to say, "Oh yeah, I understand. This character is going through this. I understand why he's going through it, and maybe my friend has having similar thing, or maybe I had something similar." So it's more organic conversation as opposed to kind of an awkward like, "Hey, let's talk about depression or talk about anxiety or talk about this and that." That it seems very it's like a tough topic. Even me being a doctor, trying to see how I would approach it to my own kids that's not awkward. So I think by using that book as a stepping stone, saying, hey, have you read that book or that story? What did you think? What do you think about that character? What he went through? It's more like a easier stepping stone for them to like, okay, now that we open up those doors, let's dive into this more.
Yeah, I genuinely think that stories and books, things that kids can pick up and read themselves and reflect and go through the journey of the protagonist in the books.
Mhm.
I genuinely think that is going to be a quite remarkable tool for kids to understand what mental health is, what a lot of people experience, and what a lot of things are normal as well, especially during a very complicated time between like 10 and 20 is like, so much happens. You grow so much physically as well as like emotionally and psychologically. I really think that books and literature and stories and uh, that's going to really be a really incredible tool for parents as well as kids um, during those tricky times.
Yeah. I mean, my biggest takeaway message from parents would be that it's okay to say you don't know. I think when kids open up to you about certain things, they just want to feel validated and want to feel heard. As long as you validate their feelings and you make sure that they felt heard. I think that's the most important thing. Let's say they're opening up to you. You can say I'm really I hear what you're saying. That must be really tough what you're going through. You know, or say mommy or daddy doesn't know all the answers, but we will find all the answers for you. We will, go see the doctor. We'll get through this together. So I think that's the most important thing is trying to instead of trying to have all the answers or pretend like you know everything. I think that's more harmful than saying, I understand and I don't have all the answers, but we will go find you some answers.
Yeah, I think just the idea of dealing with that situation with compassion, love, and reassurance just goes an incredibly long way. Everyone, not just children, this is what they want to be heard. They want to be um, understood, and I don't think we all want quick. We all don't just want to be fixed. We don't want just like somebody to just come at us with the boom 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 with the answers.
Yeah.
We want space to be held. It's a process. It's something that's very individual, but having the support of your parents or close family members and friends will turn that process into something positive, something that was incredibly worthwhile to learn and to develop as a child and as an adult.
Hmm. Exactly. Yeah. So I think, like I said, you don't have to have all the answers. You just have to be there, and that's all the kids can ask for.
Yeah, showing up is 95% of it, I suppose.
Yeah.
That's awesome. Well, how can people pick up the book? How can people learn more about it? Where should they go to do that?
Yeah. So to find out more on the book, I do have a website, the Adventures of Max and Friends.org, or you just Google the Adventures of Max and Friends, and my website should show up. It has the release date of each book on there, and then you can buy the book through the clicking on the website as well. And then at the end, there's a contact me where you can send me email information, any questions you might have about the book, or just some dying questions you want to have on mental health, and I'll do my best to answer all those questions.
Wonderful. Well, that's great. I'll make sure that that website is linked in the show notes so people can just click and get there right away.
Perfect.
But thank you so much for joining me today. I've been re-inspired to. I mean, I love books anyway, and I also love storytelling to my kids. I usually make my stories up. I find that to be quite fun. I ask my son like what he wants in his story,
Okay.
and then I'll just kind of like throw something together. It's kind of fun and
Fine.
different every
Cool.
night. It usually involves a car wash, unicorn, and someone random, but it's kind of fun to throw that together. But I think storytelling, I think books is a remarkable tool for learning and healing. And I'm very glad that you are out there and you are writing these books and you are, teaching and really supporting a lot of people.
Thank you. Thank you for having me. It was a pleasure being on the show.
Awesome. Well, thank you very much again. Awesome. Well, thanks for listening, everybody. I'm going to put the website so you can pick up the Adventures of Max and Friends and learn more about it. And if you've got any questions, you can send them to Nee on his contact on his connect with him section on his website. Don't forget to subscribe if you haven't yet. If you're on iTunes, please leave us a review. Pretty sure you can do that on Spotify now. Just hit the 5-star button. That's good stuff. But that's it. Thank you so much for listening to True Hope Cast, the official podcast of True Hope Canada. We'll see you next week.